Ever wonder why some people seem perpetually tired, regardless of how much rest they get? Imagine the body as a bustling city, with red blood cells as its diligent mail carriers, tirelessly delivering oxygen from the lungs to every corner of the body. When these mail carriers start to dwindle in numbers or their quality diminishes, it's as if the city's mail service slows down, leaving areas of the city or body deprived of essential oxygen. Anemia isn't a disease in itself, rather. It often signals an underlying health issue. It's like a check engine light in a car, indicating that something isn't quite right under the hood. There are several causes of anemia, and they all boil down to three basic types. Anemia caused by blood loss, anemia caused by decreased or faulty red blood cell production, and anemia caused by destruction of red blood cells. Blood loss is the most common cause of anemia, especially in women of childbearing age due to menstruation. Other causes can be more sinister, such as ulcers, hemorrhoids, gastritis, and regular use of pain relievers like aspirin, which can lead to gastrointestinal bleeding. When it comes to decreased or faulty red blood cell production, the reasons can vary from a lack of certain nutrients in the body, like iron, vitamin B12, and folate, to more complex conditions like bone marrow diseases or an altered hemoglobin, the protein that enables red blood cells to carry oxygen. Lastly, certain diseases and conditions can lead to the destruction of red blood cells faster than the body can replace them, such as sickle cell anemia, infections, certain drugs, and autoimmune attack. Now, let's bring it all together. Anemia is a condition marked by a deficiency of red blood cells or of hemoglobin in the blood, leading to weariness and pallor. It's like a city with a slowed-down mail service where oxygen delivery is delayed or insufficient. Its causes can be grouped into three categories: blood loss, decreased or faulty red blood cell production, and accelerated red blood cell destruction. So what can be done about it? Treatment depends largely on the cause. For anemia due to blood loss, the solution might be as simple as taking iron supplements to replace the lost iron or consuming an iron-rich diet. For those with vitamin deficiency anemia, supplements or dietary changes can also help. In more severe cases, transfusions or procedures might be necessary. For anemia caused by underlying diseases, treatment will focus on the cause. This could mean managing a chronic condition, altering a medication that's causing anemia, or treating a disease that's attacking the body's red blood cells. So remember, if you're feeling unusually tired, it might be more than just a bad night's sleep. It could be your body's check engine light telling you that your oxygen delivery system isn't running as smoothly as it should be. It's always worth checking in with your healthcare provider to get to the root of the issue. After all, every city thrives when its mail service is running efficiently.